Today I'm going to be talking about what stroke is and how to prevent stroke. But before we talk about what stroke is, we need to know what brain is and what are its functions. Brain is the important organ in our body, and it specializes in many functions such as sensory functions, which include motivation, speech, and motor functions such as body movement and etc. Have you ever wondered what would happen if an artery that supplies oxygen and nourishment to your brain gets blocked by a clot or any sticky substance called plaque?
What is stroke? Stroke is a medical condition that occurs due to lack of nutrients and oxygen to parts of the brain. A stroke happens when the blood flow to the part of the brain stops. A stroke is called a brain attack by layperson. If the blood flow to the brain stops for a few seconds, the brain cannot get enough oxygen and brain cells starts dying. If the damage to the brain persists for a longer time, brain can experience permanent damage. The signs and symptoms of stroke are difficulty smiling, weakness, numbness, blurred vision, confusion, and difficulty moving parts of your body. There are two types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic stroke occurs when a blood vessel that supplies blood to the brain is blocked by a blood clot. Fat, cholesterol, and other substances collect on the artery walls, forming a sticky substance called plaque. This could happen in two ways. A clot could form in an artery that is already too narrow. This is called thrombotic stroke. A clot could break off in another place in the brain vessel and travel up to the brain. This is called cerebral embolism or embolic stroke. Major type of stroke is called hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in the parts of the brain becomes weak and bursts, causing blood to leak in the brain. Some people have defects in their blood vessels that is more likely the cause of stroke. What could you do to prevent stroke? Take healthy diet, prevent the high blood pressure known as hypertension, reduce the salt intake, increase the physical level of activity, avoid smoking. Did you know that smokers have double their chances of stroke than non-smokers? Diabetes can also cause the weakening of your blood vessels, thus causing hemorrhagic stroke. Arterial fibrillation. Arterial fibrillation is a form of rapid heartbeat that can increase the level of blood clot in your blood vessels, supplying blood to your brain. So this could cause hemorrhagic stroke. So if you're on medication, be sure to take your medication on time as prescribed to keep your heartbeat normal. Alcohol. Drinking in moderation won't affect your risk of stroke, but drinking too much can, so control your drinking.